Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the Ask Dr. Pane segment, where Dr. Pane will answer your questions live on YouTube. Dr. Pane, this week's question, we have a fellow from our Facebook page, wants to know if a CO2 laser will get rid of his acne scars. Dr. Pane, what would you suggest in this situation?
Well, it's a good question. When I looked at the pictures, the person has acute kind of cobblestone appearance scars on both cheeks. They're not super deep, but they're not minimal. He wanted to know how much percentage of improvement he can get. I would say CO2 laser is pretty much an excellent way to handle these scars. It's not the only way. There are a couple different ways to do it. There's something called fractional laser, Fraxel, which is essentially CO2 broken up over several sessions. So the advantage of that is you don't have to go through a big recovery from any one treatment. The disadvantage is you got to do it about monthly, usually about 6 treatments. So you stretch out your time commitment. With CO2, it is a precise ablative therapy. That means it's taking off the top layer of skin in a very even fashion, very precise because it's a laser. And the downside is you have to go through a little bit of a more intense healing. You do have essentially, and let's be honest here, it's a very controlled superficial burn to the skin. And what the idea is, it takes that layer down, it's like planing. And then as your body heals, it's going to heal in a more even fashion than the scars were before the treatment was done. I prefer the CO2 because I think people are better off just going through it once, getting it set, and then you're done once you've healed and so forth. So there's a little downtime, about a week or so, when things are healing, and then you're pink for a while. Fraxel is also an option, though, because not everyone wants to do the CO2. So again, there's trade-offs for each one of these options. But I tell people, think about roughly 50% improvement. If somebody is doing the laser, knows what they're doing, and is thorough with it, and not too superficial. Sometimes people are afraid, and you end up with less results. You got to know how to do it. If you do this well, you should % improvement. What that means is never going to get rid of the scars perfectly, but it's going to improve them. Sometimes people will go through this treatment they'll do it once, they might do it again in a year and a half, get it even more improved. It all depends on where they're starting from, what their goals are, and how they do with it. But CO2, excellent way to handle the treatment. There, you have to be off Accutane for a number of months, at least 6 months. Most people think about that amount of time. And you can't have any active acne going on. You want to make sure that it's been treated and it's cooled down and you're left just with scars. So that's the overview of laser, how you handle acne scars with laser, what the different options are. Good place to start.
Well, thank you, Dr. Pane. If you have a question for the doctor, please reach out to us via the website, Instagram, Facebook, or LinkedIn. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.
And stop.